I picked ALS because I had a client when I was doing home health care. I had her for 9 months. I helped her with her daily living, cleaning, feeding her, putting her to bed. I did range of motion with her fingers to help get her just to feel good for just a moment. ALS is a muscle deterioration of the muscle. You don't come back from ALS. You can live with it. Stephen Hawkins lived with it for 55 years. That's with extreme care, a lot of money, a lot of technical knowledge and brain knowledge. And Lou Gehrig, which is named after too, he died 3 years after being diagnosed with ALS, because it was back in those times where they didn't have much knowledge and much know-how. So 3 years, you can live with ALS 3 years up to 10, if not a little bit more. Stephen Hawkins was a very extraordinary case. It attacks the nervous system, which disconnects the muscle. And when there's no movement in the muscle dies. Signs and symptoms: trouble walking, tripping over things, hand weakness, clumsiness, slurred speech, not being able to swallow. I had my client, her name was Tina. I had permission from the family to do so. When I met her first, she could be able to feed herself. And that was like in February. When I came back in March, she could not feed herself. As she progressed really fast, because it was a very aggressive ALS that she had, she basically died of malnutrition because her esophagus is a muscle which does not work. So with ALS, it can go one or two ways with ALS. You can either get it just because you got it, or your family. It can be a generational thing. With Tina, her father had it. Her brother had it. Her two brothers had it. Now, her father's father might have had it if he didn't die with a heart attack, because of the genes being so strong in her. It probably was that he had it. So then with generational, if the father has it, the children will definitely have it. And if the mother has it, the children have 50-50 chance of having it. So it's more or less in the father's gene that passes it on. And muscle weakness and stiffness, that's basically what she had. When I would do range of motion, it would be at night whenever she would be more relaxed in bed. So we had a routine. I started on one side, did her arms, hands, feet, and went around. And that was when story time was come. It was always a pleasure to just be around her, learning how her family had it. And another reason why I picked ALS is because my friend in high school, her husband passed away from it. And whenever I was going through it, she was a support system for me. She talked me through it. She understood. So that's why I picked it, because it's so fascinating how it affects everybody differently, and the different variations of how aggressive it is or how slow it is. Gleason.
Jeanette,
Yes.
What do you think the hands-on approach did, if anything?
The hands-on approach helped get the blood flow to the parts of the body, the appendages, hands, the feet. Just helped to get oxygen to those parts when they're not moving, and also pressure sores. When you're not moving, pressure sores do happen. So moving the parts that I could helped her in a lot of ways, and it also helped her to feel like she wasn't always alone.